The Delta variant continues to sweep across the globe and across Israel, now accounting for 90% of new coronavirus cases in the country. And the health ministry announcing that the vaccines are only 39% effective at preventing infection, though other countries such as the UK have claimed much higher rates of effectiveness. Nevertheless, Israel continues to struggle with containing the spread as the government has reintroduced the Green Pass. So here to discuss this and more is Professor Manfred Green, MA, Public Health Director at the University of Haifa. Thank you for joining us.
Thank you.
So let's start with the situation here in Israel. The numbers are rising, more people are critically ill, hundreds of new cases every day, the government reintroducing restrictions. Can we now say that we are in the midst of the fourth wave?
You know, the waves of disease are generally related to a number of factors. One, obviously, is the reduction of restrictions. And the other is new variants that may be creating more disease because they spread more easily. So these are factors that we need to take into account. There is an increase. The most important measure of the seriousness of the spread are the number of severe cases and obviously those who've deteriorated into critical and the deaths. So we're not really seeing a very large number of severe and serious cases, but the numbers are rising. So we need to watch that very carefully. So I would say we need to cautiously maintain some of the restrictions, and we need really to allow life to go on as normal as much as possible.
Now, the health ministry over the past few days released a number of interesting statistics, most notably that the vaccines are only 39% effective in preventing infection, so much, much lower than we were initially led to believe. Yet on the plus side, they said that the vaccines are still 91% effective at preventing serious disease. But these are still startling numbers. I mean, what does this mean now in terms of the spread of the coronavirus in Israel?
From the point of view of the spread of the disease, it's obviously good to have a vaccine that is very effective in preventing infection. But really the aim of our vaccines is to prevent serious disease. So we're seeing that the vaccine is still very effective in preventing serious disease. There is a decline in preventing infections, maybe related to a couple of factors, one being new variants like the Delta variant, the other being that there may be a decline in the, what we would say, the immunity of the population we started to vaccinate very early. So some of them received their vaccine 6 months ago. So we need again to check that. But at the moment, we feel that the vaccine is still very effective, and the more people that get vaccinated, the better we will control this pandemic.
Now, if we look internationally, right, and we compare the health ministry numbers to other studies, for example, the New England Journal of Medicine also released a study showing that the vaccine was around 88% effective, and Pfizer saying its vaccine is over 90% effective. So I'm asking, how can there be such a discrepancy in the numbers in all these studies that we're seeing?
Right. You need to understand basically the way in which vaccines are developed and tested. So the vaccine is tested in the initial phase on what we call a phase 3 study, but essentially after we've done the safety testing and so on. So in the phase 3 stage, we do it in a larger population for a limited period of time, and that determines the efficacy. But it doesn't necessarily look at the efficacy or the effectiveness for a long period of time. When we start to vaccinate, so we'll get then the efficacy figures that we had, 95% and whatever, but that was for a couple of months. Once you go into a period of time where we're going for a number of months, like 6 months, then you'll see a decline, a natural decline often in these vaccine efficacy. And that probably is what is happening now. Again, together with the fact that the vaccine is a little bit less effective against the Delta variant. So remembering again that Israel is still one of the countries that started to vaccinate early. So we will actually see the decline, so-called decline in efficacy a bit earlier. But again, I repeat that the vaccine is still very effective.
And finally, I want to touch upon the issue of reopening schools, right? The cabinet receiving a proposal today because a lot of parents, myself included, want to know, do you think, given all the new statistics and the fact that there are still currently no vaccine for children, that schools should reopen as usual on September 1st? And what steps do you think should be taken?
Well, I'm sure you know, and you would probably tell me the same thing, that the problem of keeping kids out of school is a major issue. I mean, it's something that uh, is not good for the kids, not good for the parents. So we need to find ways in which we start to live in this life where we can actually bring kids back to school. I think that if we are careful, if we use masks in the school, I think in the classes we should maintain masking of the kids. Outside, they can take the masks off, give them time to take the masks off. But that should be maintained. I think the other issue that we need to look at is to invest in better ventilation in schools. And this is something that I find difficult to understand. This is a long-term investment, but this is the time to start. The ventilation in classrooms is very poor. There's very little filtration. And this should be done immediately so that in the long term, we'll have much better filtration and ventilation, and we'll cope with other epidemics, which will come in the future.
Absolutely. Professor Green from the University of Haifa, thank you so much for taking the time to speak with us today.
Thank you very much.